Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course.
Talk about how to unlock your hip flexors with these stretches, which is good for hip pain and low back pain. And we're going to show you right now. I'm going to jump right into this, Brad.
Right,
I'm not going to waste any time. So yeah, get him.
Yeah, let's get him situated.
Yeah.
There you go.
All right, so this is one of the main hip flexors, the Iliopsoas. And as you can see, it's actually hooked up into the spine here.
Sure.
And then it goes down and hooks up to the hip here,
right.
the lesser trochanter. But can you see if this muscle is tight, how you would actually pull you forward? And that's what can give you back pain. It can give you into that anterior pelvic tilt, and it can also give you keep you flexed.
Right. So that puts more stress on the back muscles as well as the spine and the discs.
And the hip itself.
Sure. It's all connected.
You also have muscles that go across both the hip and the knee, like the rectus femoris and the sartorius and the tensor fasciae lata. So if those are tight, those are all going to pull on this whole complex too.
And actually, they'll connect right up to this ASIS and over, which gives them a little more leverage.
But it also pull down.
Right.
So
tilts that anterior tilt even more prominent.
So what we're getting to, the point we're trying to make here is that
we're boring people.
You need to stretch this. You need to stretch these muscles, and we're going to show you how to do that. By the way, if you are new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. And also, please go over to Facebook and like us, because right now we only have this guy that likes us, and that's not saying much, is it, Brad?
Well, it's better than nothing.
Yeah, I guess it is.
Let's get him out of here.
Even he wants to leave. All right, let's show first, Brad, how you can tell whether or not your hip flexors are tight.
Sure.
One way, just a basic way, is if you're laying flat on the ground here on the floor, and you can't even do a pelvic tilt, like there's a gap right in here. If I can't take and flatten my back.
Move your hand. There you go, Bob. Do that again. Because you can see his belt. Go that again. So he's arched here. There you go. So he's pushing that stomach down. It's kind of hard to see, but his pelvis is rotating back.
But we got a better way here, Brad. Let's show the better way.
Let's look clear.
So Brad's going to be the patient here, and you can do this yourself, though, and you can just see yourself. I'm going to show you how to look at things. So you're going to sit on the edge. Well, I guess you can do it on the edge of a bed. It'd be better on the edge of a bench.
Yeah, you need something firm.
Firm.
It might be hard to do at home.
Yeah. All right, lay back, Brad. So he's going to lay back, and he's going to pull up on one leg. So we're testing this one here. And Brad's a good subject here because, look, he is tight. The first thing you're going to look for is the back of the thigh hitting the bench? And his is not. It's actually raised up a little bit, which tells me that the muscles that cross his hip are tight. Now, the second part, the muscles that also cross the knee, they're also tight, because look at his knee. It's almost straight here. Generally, with someone who's not tight, it would go up to at least 70 degrees. 90 is a right angle. You feel that, don't you, Brad?
Oh, yeah, Bob. Thank
you. And 70 would be about right here. That's about normal. But his is about, I don't know, 40?
Well, what do you say, Bob? You know, that's the way life is. But let's take a look at the other one.
All right, let's look at the other one. So now he's going to go ahead. We're going to compare. He's going to go a little bit off on the angle here. And this one goes out. Now look at this one. This one goes down. The thigh is actually hitting the bench. The knee is still bad. So your quads and your tensor fasciae lata and your sartorius are all a little bit tight yet. Not as tight. So you're a little bit better on this side. You're going to have to focus on this side, Brad, and a little bit on this side too, especially your quads.
And lo and behold, it does make sense, because I have had injuries and whatnot on my right side, and if I do have some problems, it's my right side. So,
and he's had injuries more than that too. So, all right, Brad, let's first start off with bridging. Do you want me to go ahead and do this?
Should we move this?
Yeah, let's move over.
Get centered, Bob.
Now, what you might want to do is even start off with actually just doing a little bit of a pelvic tilt here.
Pelvic tilt, yep. So he's going to tighten the abdomen and make that pelvic rotate backwards.
The reason I want you to do that now is because then you can also do it while you're doing like bridging.
Right.
So bridging, you can start off just by going up this, and you're stretching the hip flexors here a little bit, even a little bit of the two joint, hip flexors.
Sure.
And when you get up into this point, now you can actually do a pelvic tilt here.
Now, if you've never done this before, it takes a little practice.
Yes, it does. This is not that easy a thing to do. And also, if you want to make it even more advanced, Brad, put your heel closer to your butt.
All right, so he's bringing this closer.
And now I'm stretching across the two joints again, the
Right.
hip and the knee. And then I'm doing the pelvic tilt.
So he's getting that sartorius and that biceps femoris and
Yep.
all those lovely long muscles.
Not the biceps femoris. That wasn't one of them. It was the tensor fasciae lata was the other one. So, oh, we forgot to mention, by the way, if your leg goes out, it's the tensor fasciae lata is tight too.
Right. The biceps femoris is biarticular.
It is, yes, but it's on the back.
We can talk about that.
All right, next one, Brad. We're going to go ahead and
No, it's on the front. It's right here.
All right, we'll have to discuss it later.
Well, this is off the
All right,
front.
now we're going to go ahead and do the, we're going to do, this is a standard one. This is the one I like to do, Brad. You're going to go ahead and get a pillow usually because it's kind of uncomfortable when you kneel on the floor. But I'm going to go ahead and I'm going to lean forward like this.
Yep.
And
Here,
I'm going to pull
move
forward.
this arm, Bob. So there you go. You can see.
You can see my microphone there probably too.
Yeah. So he's got this angle here and this angle here. That would be the hip extension that we're working for to get these muscles to stretch.
Now we have found too, if you do stretch down like this, it does give a different stretch and it does stretch it more.
Yeah, and we didn't, we actually did this because we found it on another study, and it's like, we didn't think that was really going to work well, but it actually does to a degree.
Can you hand me the strap, Brad?
Yeah.
So we got to use the stretch out strap if you want to get advanced here. Some of you can probably grab this.
Rectus femoris.
Yeah, rectus femoris. I knew you
Brain
were wrong.
fart, yes.
He was saying bicep femoris.
Yeah, Bob, you got me again. Well, we got to see what our listeners say about that.
So this is an advanced stretch. If you got your stretch out strap, we always list our products below in the comments section there,
Sure.
or in the description section. But you can go ahead and get a great stretch here.
I bet you can really feel that right now.
Yeah, this is a nice advanced stretch. This is, if you were only going to do one stretch, this might be the one I'd have you do. And if you want to actually stretch the rectus, not the rectus, now you got me saying rectus femoris, iliopsoas more, you actually can lean over this way a little bit.
We got skin showing, Bob.
Yeah.
This is a family show.
Yeah, you remember how it attaches to the side of the bones?
Right.
Yeah.
Yep.
So
we're going to get the TFL, that muscle up in here, goes all the way down to the knee. They're going to stretch that out.
yeah, and you can actually do some pelvic tilts with this too,
Right.
Brad. You can actually do the pelvic tilt here. Ooh, I actually do feel that when I do that.
Oh yeah.
So
this is really. I mean, you got to be pretty agile to put yourself.
yeah, to
in
do
there.
all those, but you can certainly start with this one, and then work your way up to adding the strap on there. So
And don't do it on a table. Go down to a floor to do it.
right. All right, another simple one, Brad. Believe it or not, this is good for your back and for your hip. Is actually, now you got me all tied up here.
Well, of course. I didn't want you to get away.
Is just prone press ups.
Oh yeah.
So we always advocate for these for the low back.
Sure.
For most people with back issues, this is a great one to do. But you're also stretching your hip flexors when you do
Oh
this.
yeah. Right
So-
in here, we're getting a nice hip flexor.
Now
stretch.
imagine if you go like this, you stretch your two joint a little bit, wouldn't you, Brad?
Yeah. It's kind of
Little weird.
Try it with both legs. See if how good you are, Bob. Oh
Yeah.
wow. Do you feel it more?
Yeah, yeah, you do. It's not a one that I would do probably, but because I like doing the other way instead. But
Right.
the prone press ups do work well for that. All right. I think. Oh, I was going to show this one, Brad. This is a different one here too. You're on this side. If you want to do this, you can put your one leg on the bed like this.
Yep.
And then you go up like this.
So yeah, right in here.
And again, if
That's-
you went like this, that would stretch
Right.
the two joint here. So.
Be careful about a hamstring cramp if you get those
Yeah.
easily.
They can fire up pretty easy here,
Yeah.
but this is a little wacky, but this is a great stretch
Yeah,
for the
you're
hip
really
flexors.
getting after it there, Bob.
Yep, I am getting it after
I mean,
it.
that's going through the whole chain.
All right, Brad, do you want to show the foam roller?
Oh yeah, I love the roller.
So if you want to use a device, we like this one from, we have it down in our product section too, because it's a little bit softer. It's a little bit easier on the body.
It's a good quality.
It's a good quality foam roller.
Yep.
It's from OPTP.
Okay, so we're going to do a little anterior hip stretch here. Is that what you were thinking?
Yep.
All right, so I'm going to get on that. I'm actually going to start up higher, just below that pelvic line, that pelvic.
Working that way.
ASIS, yep. And I'm going to work here. And You usually have to put a little bit of an angle on this so that you can get into that muscle, and you'll know because you'll feel it.
Yeah, and plus you could get the tensor fasciae lata,
Yeah.
which is goes into the IT band.
Right.
Because that's going to all work that too well.
Now, this actually feels like a really nice massage, Bob. I'm real happy right now doing this on that TFL.
I'm glad you're happy, Brad.
Yeah. Oh. You want to finish?
All right, well then you can work your way down the quad too if you like.
Yeah.
So,
you know, and you could bend the knee up so you put a little stretch on that muscle. And I'm just going to do one leg at a time because I can kind of rotate and get force
get a
on
little
there.
more pressure on there.
And you can feel, you know, if you got some tight muscles, this roller really does a nice job on working them right up to the knee. I'm just doing this because it feels really good right up in there, and I'm going to roll all the way back and work the whole thing.
And the final thing, if you have one of these Peer Wave massagers, you could certainly work with that too. You could go ahead and you know, turn it on, and you could go ahead and work on stretching that hip flexor while you're in this position, and giving a little bit of massage while you're working on it.
You bet.
So we like these massagers. They have percussion and not just vibration.
Right.
So
and they get in deep. It's probably it's the deepest massager I've ever worked with.
Yeah, I used this on a patient, and he was just amazed.
I mean,
it was one of those things like don't get too overconfident. I'm sure. I mean, it's not going to make a difference in one treatment, but it seemed like I can already dance around. He said,
sure.
I can feel a lot better, so it was kind of cool. But
all right,
thanks. Remember, Brad and I can fix just about anything
except for
a broken heart.
Oh, there it is.
But we are working on it.
Yeah, and we're
hard.
We're never going to stop. We're going to persevere.
Thanks for watching.